I think it's amazing when people share their experiences about different types of treatments. It really normalizes the conversation surrounding aesthetics, dermatology, cosmetics, all of those things. But the beautiful thing about neurotoxins is it's been studied for decades, right? So today I really want to separate what's an experience versus what's evidence-based and talk about what's actually known. There are many neurotoxins on the market. All of them are FDA approved, which when you're going to a medical practitioner, when they're using botulinum toxin type A, they all different based off of the complexing protein attached to it, as well as the stabilizers, right? Current FDA approved neurotoxins are Botox, Ono, botulinum toxin A. You have Abo, botulinum toxin A, which is Dysport. You have Zeman, which is Inco, botulinum toxin A. You have Juva, Pre, botulinum toxin A. And then you have Daxxify, which is a newer one that came out in 2022, which is Daxi, botulinum toxin A Lam. And usually in office we carry a variety of things because people have different allergies. So if you have an egg allergy, the neurotoxin that we usually recommend to avoid is Dysport. Dysport is the main one historically noted to contain trace amounts of cow's milk protein, which is casein, and it uses albumin-derived human plasma. So essentially it doesn't really have egg directly, but some people have been noted to have allergies to it. The main difference with Daxxify is it uses a stabilizing peptide instead of human serum albumin. It really doesn't matter to you, but it helps with it allows for a different binding behavior at the neuromuscular junction, so it contributes to longevity. This has been FDA approved since September 2022 for temporary improvement with moderate to severe fine lines in the glabellar region. Clinical trials did show that a mean duration of 6 months up to 9 months in 20% of participants versus 3 to 4 months. I have never found anything longer than 6 months. Usually my patients come in every 5 to 6 months for a re-injection. So anecdotal experiences are invaluable, but they can unintentionally create misinformation when missing key components are withheld. So that's going to be like dose technique. So a patient might say like, hey, this didn't work, when in reality they may received a lower dose than reality. They could have been not the right candidate for the higher dose. And some clinics I've noticed are charging premium amount for Daxxify, but they're only giving the clinical equivalence of Botox, when in actuality they need to be giving double. They can also have different things like anatomy plays a huge role in this. So if you have something like hooded eyes and you're looking for a super frozen lid, or frozen forehead, you are not a candidate for it. So you're going to have a lower dose to accommodate short-term benefits of a smooth forehead, but it's going to wear off a little bit faster to compensate for the prevention of having hooded lids for too high of a dosing up here. So let's talk about longevity and the correct dose. That's usually what is equated, with a few exceptions. So duration equals dose, right? But there are other factors that influence that. So your immune response, your antibody formation, your muscle mass, your strength, how intense of workouts you're doing, whether it's cardio, heavy lifting, HIIT, your dilution ratios, your metabolism, the injection technique, how thick your skin is, how thick the muscle is. So precision is super key, and there are nuances to that. So even correct dosing can vary, resulting from different outcomes, different muscle behavior, different skin quality, and then depending on what's going on in your life, can it really impact your longevity. And one biggest thing that I always tell people about is anatomy, okay? Why does anatomy matter? So you have your frontalis, right? This top muscle here. You have your glabellar. Frontalis is the muscle that helps with the brow lifting. The glabellar complex up here is helping to pull down that muscle. So treating only one area can create an imbalance. Heaviness, it can create Spock, it can create a Neanderthal look, and all variations of that. So that's why I treat the upper face as a system, not an isolated zone. And especially important when it comes to hooded eyes. Over-relaxing the frontalis can really reduce the eyelid support and really worsen heaviness. So Candidacy is super important. My approach is harmonizing your eyes, your face, the upper third, the mid third, the bottom third, to really allow for a natural result, expression, and symmetry all around. But we can't always get that immediately with one session. So you want to make sure that you're talking to your provider, communicating what your needs are, and they're also assessing your anatomy for you to really understand how these muscles and movements work. Remember, the lower you have all these fine lines right above your brows, the more you're going to get a drop type of look. So we discussed lifestyle a little bit before, and biological factors that really influence the longevity and, your outcomes when it comes to neurotoxins. So exercise, high intensity, cardio, heat exposure, so saunas, hot yoga really can impact your results. Sun exposure, so UV stress, can also impact the inflammation and reduce the longevity. Stress and cortisol reduces the relaxation time. Certain supplements and medication and antibiotics can influence it. So if you're zinc deficient, that could impact it. If you're on certain antibiotics, that can impact it. And then consistency. So regular, properly spaced treatments can really train the muscles and extend the duration over time. So if you're trying a new type of neurotoxin and you're saying, hey, it wasn't for me after one treatment, you're not getting the full impact of what it could actually do. Overall, every experience is valid, but evidence helps to interpret it accurately. So we want to make sure that when we're talking about neurotoxins, one of the most studied aesthetic treatments in the world, outcomes really are dependent on dose, anatomy, the injector precision, not only brand alone, and then of course your own metabolic function. Longevity is actually a science based off of so many factors that we discussed, and I always want to make sure that you're getting the proper explanation when it comes to the timeline of how things work, as well as dose, muscle mapping, anatomy, and all of those fun things. So in actuality, I got a comment that the time frame is suggested. The duration isn't random. It's not suggested. It's based off of clinical endpoints established by the FDA. Medium duration is about 6 months, and 20% maintain effects through 36 to 40 weeks. Onset does not equal duration. Feeling or seeing movement, small movements at the 2 to 3 month mark, doesn't mean the product is gone. Clinical wear-off is measured when the lines start to go back to complete baseline, not when you see subtle movement or moderate movement. So you can regain a little bit of movement long before the muscle actually reinnervates. I hope I was able to answer some questions and pique your guys' interest. If you have any other questions, please feel free to leave a comment below.